Welcome to InCast, Enjoy Health Education's podcast for dedicated healthcare professionals, educators, and administrators who are passionate about making a difference, encouraging healthy outcomes, and finding innovative ways to engage and empower new families and staff. Here's your host, Debbie Young. She's been a childbirth educator and doula for almost 30 years and came to Enjoy based on her love for educating families.
Thanks for joining us today for InCast from our podcast from Enjoy. We have a special guest today, Sarah, who is the Labor Junkie RN on social media. Many of you probably recognize her face, and I think she's doing a lot to get real exposure about birth, what's going on in birth, and I really enjoy her reels whenever I come across them. So, Sarah, thanks for being with us today.
Thank you for having me. I'm so excited.
Yeah, how long have you been an influencer?
So I don't. It's funny to call myself an influencer. I started making content about 2.5 years ago on TikTok.
Okay. And why did you choose to do that? What spurred you on?
So the origin story of how I ended up being on all these platforms is I've actually been a nurse for 15 years, and I've spent the last 10 years doing high risk labor and delivery. And if you live in America, you probably know that we have really, really bad maternal and fetal mortality rates among developed countries. We also still struggle with a lot of like economic and racial disparities in healthcare, especially with women's health. So this was something that that you just see. And I just felt like I was having conversations about things that people should have been told so much earlier in their pregnancy. They shouldn't have be finding this stuff out the day of their birth or after they gave birth on the fly. So I was having these same conversations, the same educational points again and again for years. And finally, I just was like, I feel like all the women out there deserve this information, and I want them to have all the evidence, what we know about it, and then give them an opportunity to make decisions that feel right for them and their situation and collaborate with their provider instead of it being more they're being told to do things and led into decisions. So I actually, so about 2.5 years ago, I started my TikTok account, and I had tunnel vision. I knew exactly what I wanted to do. It wasn't like a personal account. My very first video was something educational, simple little things that I ask my patients when they come in, is your baby moving, things like that. So I made a little video about that. And every day, as anytime I could, I'd put my babies to bed and then I would start shooting content. And I'd go to work, and whatever conversation was coming up with my patient, just like common questions, I would just make a note of it and be like, there's another thing people are asking or they've not been told. I'm going to make a video about it. So I just wanted to kind of, in my small way, whatever I could to help sort of like mitigate some of these disparities and give women, families the same information, just so that they maybe would have like a higher chance of a better outcome with their birth.
Yeah. And today, later on, after we're finished with this, we're going to be discussing natural childbirth, which is another thing that I've heard you talk about. But you said you have babies,
Mm-hmm.
and did you go to childbirth class or anything before you had your babies?
I did. So I had a really unique experience of being a nurse and a labor nurse for years before I ever had children. So I had all of the knowledge on the back end of it as a professional, but I had never actually given birth myself. So even though I had seen this play out with other people again and again and been part of their story, and I had an idea of what I was looking for, I also knew that for my husband, this was completely new to him, and I wanted us to be aligned and on the same page when we had a baby. And I also knew that it doesn't matter if I watched this play out again and again and again for other people. I'm my own person, and there surely are going to be knowledge gaps and things that I could practice and learn just as a mom. So I did prenatal yoga. I did I did whatever like little birth DVD I could get my hand on. And then I took a birth class with my husband. We even took a newborn care class with my husband. I that one, I kind of was pretty good at caring for newborns, but he never cared for a newborn. So it was really, really good as a couple too.
Yeah, yeah. And I've been following you for a while, and I noticed that um, there are times when you finish a reel, and I'm like, oh, parents are going to get so much out of that. And then there are other times when I'm thinking, myself as an educator and as a doula, and all my educator and doula friends are going to get so much out of that. So I appreciate that you're speaking to both sides of that story because we're all involved in this miracle of birth.
Yeah.
So, what platforms do you show on?
So I am on TikTok, Facebook, Instagram, and YouTube. I'm on
Okay.
all of them.
And you're a busy mama and a labor and delivery nurse. So
I am,
because
yeah.
of
I'm like
you
four
do all
hats
those things.
wearing.
Cool, cool. Well, I have five kids and I had four of them without medication. And then the fifth one story we'll get into later. Um, what was your thought process when you went through the childbirth education class? What did you and your husband talk about, like your dream birth would look like?
So I knew that if it were possible and safe, that I wanted to go into labor spontaneously, meaning I mean, I don't know if the listeners will know. That just means without any like induction, it just completely my body going into labor on its own. So I wanted to go into spontaneous labor if there was no medical reason to induce. And I knew that I wanted to try to avoid an epidural, not because I've seen anything like sinister behind the scenes that people don't know about. It was more just, it was a personal choice, and that we can talk about later why I wanted that. But I wanted to try to avoid an epidural. And I think the third thing I wanted is I was very concerned about the support team that would be present with me. I wanted like my husband present, and I wanted specific family member present, and specific like nurses who kind of had a role as a doula for me. So my husband was very well versed on those preferences. And when we did the birth class, it was really good because he works for like HR and recruiting. He has nothing to do with medicine. So it was good because the birth class showed births, it showed different stages of birth, it showed at like real raw footage of birth. And then at the end, the educator kind of quizzed us because it was like a personal class, just me and them. And they quizzed us on like, they showed little clips of somebody in labor, and they were like, do you feel like this person's ready to go to the hospital yet or not? And they asked my husband, and he would be like, no, I think we could wait a little longer. Or how would you support somebody that's acting like that in birth? So it was so good. And I feel like it gave me more of a relief that he's kind of a calm guy anyway, but that he wouldn't feel fearful when I was in pain, and that he would know how to help me. It wouldn't be me not only in labor and experiencing discomfort, but like then having to coach him how to help me. It was a way, it took the mental load off of me that like he can do this, he's got it, and be involved
Yeah,
in the birth of our child. So
yeah. Awesome. Awesome. Well, I guess we should get into our topic. And
yeah.
today we're going to be talking about natural childbirth, which I looked it up. The CDC says only about 10% of women in the US have natural childbirth. That doesn't necessarily mean they have an epidural. That rate was at about 60%. But it means they're using analgesics or nitrous oxide or something else, or induction, right? I
Mhm.
guess maybe induction doesn't fall into that range, but it may cause you to choose something else anyway. So I was also kind of flabbergasted to know that in the UK, which if you've ever watched Call the Midwife, everybody gives birth without an epidural there, right? But what I found was in the UK, only 2% of women give birth without some kind of pain medication. And I
Mhm.
know that they taught us here in the US about nitrous oxide and how beneficial it is. So I'm going to assume a lot of that is also nitrous oxide. But then I looked up WHO, and they said that 90 to 95% of women worldwide give birth unmedicated. So UK and us, we're kind of the anomaly in that.
Mhm.
Um, but I chose to have natural childbirth if I could, like you said, if I could. Why? What made you? Was it seeing other people give birth, or just something in you that said, "This is my truth. My truth is natural childbirth."
I think it was a little bit of both. Because as you, I've seen thousands of births, and it's a major privilege to kind of watch that process play out again and again. And then because I know myself and I know what is real and works for me, I really could like see the whole spectrum of birth and kind of like cherry pick what I knew would work well for me. So I wanted, and I knew for me that would be just, I wanted to be home. I didn't want to be in the hospital a lot. I didn't want, I just didn't want a lot of interventions. I wanted things to be pretty hands off because that's what works for me. That's the kind of like person I am. I also knew that like I'm a pretty type B personality, but I do have like I'm a nurse, so there is like overthinking and there's worrying, and I didn't want to feel like anxiety in my labor. So part of my choice to like especially avoid an epidural or like not be induced was because I felt like if I went a more spontaneous, like minimal medicated route, then my brain would kind of have to be focused in the moment, and I wouldn't worry about like, am I dilating? What if my water breaks? What about infection? How's the baby strip look on the monitor? I just wanted to be a mom, and I wanted other people to worry about those things. And I truly was concerned because I don't sit still. I'm just moving all the time. I was truly concerned that if I got an epidural and some Pitocin and I was just laying up in a bed, that I would just stare at that clock and be like, okay, like, am I dilating? Can we get the peanut ball in? You're going to turn me. I think I would really overthink. So that was a big part of why I just was like, I need something. I need to be in tune just with my body and not overthink this. Because that's just my personality. And I also just, there's no it's not better or worse. It just was, I liked watching like a spontaneous birth play out. I just enjoyed it. I liked it. I like a C-section. I like all of it. I think it's all beautiful. That's what my job is. But like it was something I'm like, that's pretty cool. I'd like to see if that can happen for me if possible. So it's kind of
Yeah, yeah.
yeah, that's sort of where I ended up with my births.
I wonder if people in the United States, for the most part, are not thinking about natural childbirth because whenever we see a birth on television or whenever we're hearing friends talk about having their babies, there's usually medical intervention or medication involved in that. So in my class, I teach too. Um, in my class, I present both sides and say, "Hey, parents, this is your birth, and I'd like for you to take control of that and make it how you want it to be." And I think there's a fear of medical knowledge that, like, I don't have medical knowledge. How can I choose these things? But what you're doing on your reel and what I'm doing in the classroom or as a doula, I think we maybe are pushing parents to take that back.
Yeah, I completely agree. And that's exactly what my goal was from the very beginning. Like I said, I had tunnel vision and I didn't start my accounts to try to convince people that like medical intervention is bad and you all need to have a spontaneous unmedicated birth in the ocean or something. I truly just wanted to put out whatever knowledge I had. I wanted to put out whatever evidence we had, which evidence is always changing too. So there have been changes for some of the videos I made 2 years ago. And then I wanted to leave it up to them because I think the ultimate way to support, especially women, is to trust them with their decision making. We're women, we're always being told that someone needs to tell us what to do and someone else is in charge of our decisions. And I'm like, No, it doesn't have to be that way. And it really should be collaborative efforts. Like the mother should be in the driver's seat. So that's what I wanted to do. I just wanted people to feel empowered and make informed choices.
Right. And there's no one right birth for sure.
Mhm. Exactly.
But I think that people need to know what their options are. And if you don't know what your options are, if you don't know what choices you can make, it's really hard to make choices.
Yeah, that's
So,
not
yeah,
informed consent. Informed consent is, I say it a lot on my platforms. It's like, it's knowing all the risks, benefits, and alternatives to each option. And for some people, that may change what they thought they were going to do. And for others, it may secure them more in what they were going to do. So,
right, right. Show them that, yep, that's what they want. So,
yeah, yeah.
okay. So, one thing you said to me earlier was knowing that you wanted natural childbirth, but giving yourself the freedom to change your mind was important to you. And I think for me too, there's no one right way.
Mhm.
All right, let's talk about how do we, as educators, as doulas, as other types of birth workers, encourage parents who say they want to have natural childbirth to actually make that happen for them? Because sometimes people will come into the class and say, "Oh yeah, I'm going to have natural childbirth," but I, I tell them it's really important that you prepare. Like if you know you're going on a trip, you don't just get in the car. You pack your bags, you get some snacks. I mean, you do all the things to prepare to go on a trip. You don't just hop in the car and go. What kind of preparation would you say is most beneficial that we can share with our clients and students if they want to have natural childbirth?
I think it is really important to acknowledge the benefit of being prepared before you try to do like an unmedicated birth. And like we talked about earlier, are there people out there that just show up and wing it and they do it? Yes. It's not very common, at least where I work. It can happen, absolutely. And I wouldn't say that it always is the most peaceful or positive outcome that maybe somebody was looking for. So there is going to be, I think, just acknowledging that there is a benefit to preparing. Um, and honestly, I think education, like real education from reputable sources, is one of the first things I recommend to people, which would be like a childbirth class. If it is, you know, like an online childbirth video or something, if you have access to classes, that's the first thing I would recommend. And especially if it is an in-person class or like a Zoom class, because then you can like bounce ideas and questions with somebody in real time who's seeing you and hearing what you have to say. It's not just like a one-sided, you're reading a book or something. The other thing I that was helpful for me, and it's helpful for most people I know, is if you can do something to physically prepare your body, like a prenatal yoga class. And again, that if you can do it in person, better, but obviously that's not something accessible to everybody. So there's a lot of free online ways to do prenatal yoga that will kind of help instill like muscle memory, because it's one thing to go to the birth class and say how important it is to practice, you know, breathing and thinking of your mantras and relaxing, but it's another thing to do prenatal yoga and physically practice it and physically relax your muscles and your face and your jaw and your palms up to the sky. When you are doing that regularly throughout your pregnancy, it does become kind of second nature. And then, you know, instead of when you stub your toe, you kind of clench and you're like, oh, ouch, my toe. You go into labor and we lean into the pain and we relax into the pain instead of clenching up, you know, and working against it. That's like a learned skill. That's not necessarily our natural reaction. So I think that's the other thing, is physically prepping. If you can do a yoga class, something else that I think is helpful, that hopefully you'll get out of doing birth and yoga classes, is coming up with why this is important to you, why you want to do it. So you can remind yourself why you're doing this, why it matters, and it will bring you through the other side when it gets challenging. Because I mean, it's challenging whether you get the epidural or not, or medicated or not. It can be challenging. So I think if you're choosing to do unmedicated spontaneous birth, it just come up with why that matters and just like repeat that to yourself when it gets challenging. And along with that, I think it's good to maybe have a few little, it sounds silly, but like mantras in your head, like this is temporary. You're not going to feel like this for the rest of your life. It's temporary. When you're in the middle of a really, really challenging contraction, and then you're reminding yourself, like, this is going to go away in 1 minute. Like, I can do this for 1 minute. I'm one step closer to baby. This is pain with a purpose. I'm not just suffering. Like, there's a purpose. We're moving towards something. I think if you have little mantras like that, one of mine, it's so weird, was like, just be loose like a rag doll. And so when I would start to clamp up a
Oh,
little bit,
nice.
like, oh, I'm a rag doll. This is temporary. So I think whatever is going to click with you to help you through those 90 seconds or 120 seconds, whatever that contraction lasts, I think that's the other thing that was helpful. So yeah, prep would be like education, maybe physical prep, like a yoga class, and then mental prep.
There you go. Yeah. A couple of births ago, I attended. The mom had I think she probably printed them off on her computer, like
Yes,
sayings like you just mentioned. And then we just taped them up around the room for her to look at. And we moved them when it was time to push so she could see them there too. And
I
yeah,
love
I
that.
think all of those things, if that's your goal, I think probably for any birth, whatever your goal is for any birth, but especially for natural childbirth, make those things available. Make sure
Mhm.
that your partner or your doula or your mom, whoever's there, can say those back to you to
Yeah.
help you remember, right? Yeah.
Yes.
And you mentioned yoga, and I didn't look the study up yesterday, but there's a like 10% shorter labors if you have done yoga. And I'm like, I think, oh,
Yes.
10%. Okay, we'll do.
I feel like I saw
But
that
what you said makes total
somewhere.
sense. Yeah.
Mhm.
So,
Yeah.
okay. And then did you change or enhance your eating habits, your walking habits, anything else in preparation for the birth?
Absolutely. And again, we talked about this a little bit, but it's one of those things that some people may have like a really, really unique or challenging pregnancy, and some people have hyperemesis throughout their whole pregnancy, or maybe they're diabetic, and you don't have a lot of like variation with your diet. You're just trying to survive. But when I was at a point in my pregnancy where I was fortunate enough that I could do whatever I wanted with my diet, I was way more intentional about trying to like nourish my body. I was very, very like rigid about taking my prenatal vitamins. It's like impossible to have restful sleep when you're pregnant, but I tried. So, and I've said so many times, like, I'm pretty sure the fittest I ever have been in my life was when I was pregnant, because I just felt really motivated for me, for my baby, for my birth, for my recovery, that it was just very present in my mind that there's a lot of things that are not within my control. Like, sometimes things just play out a certain way no matter how well I prep it. But the few things that were in my control was how much I was walking. Was I doing my prenatal yoga? What I'm putting in my body? And I wanted to be intentional about that, because nothing can guarantee that things will go perfectly, but it would give me a higher chance that things would be like more positive for me. So I definitely was trying really hard to like be more intentional about how I nourish my body.
Mhm. It's interesting back in the day because I've been doing this a while. Um, we were radical by saying you need to probably get 90 to 100 grams of protein a day, and
Mhm.
about 40 was the recommended amount per day at the time. And so I feel a little vindicated now that people are doing like, yes, protein's good for your body. And you think about you're building a baby and the
Mhm.
baby's made of amino acids. So let's get that protein in there.
Yeah, of
Um,
course.
so I like that you're very conscious of that. That's great. One of the things I mentioned in our conversation yesterday was that sometimes people can, like you, keep a saying in your head. And so those were your mantras, the things that you knew you were going to say. But sometimes people really need to put them on paper or
Mm.
maybe draw a picture or pictures of like where they were going, or maybe even just a flower opening. I always think of as the baby's coming down and coming out, it's like a flower opening.
Mm.
So have you ever explored doing anything like that to help with natural childbirth?
So that is a really good point. There, like, I think we touched on it a little bit, that one of probably the most common way to be intentional and like vocalize your preferences is like creating a birth plan. I never wrote a formal birth plan. I had a very, like we talked about, I had a very clear birth plan. I wanted ABC to happen, but I vocalized it, and then I had a group text with the people that were going to support me, and I would text them whatever was coming up, whatever I wanted. And then I think it is good to, I would visualize at night before I fell asleep what I was hoping would happen. I mean, I know it sounds cheesy, but trying to manifest what I wanted to happen.
Mhm.
And because there's really not much more that I could do. I was trying to take my walks, I was working on my body, my brain. And then from there, I just wanted to get mental peace and hope that we move toward this birth I was like envisioning. I think there's a lot of other ways to do that. There's a lot of other ways to try to manifest the birth that you're looking for, and I think there's other ways uh, to like verbalize or communicate what it is you want from your birth, because other people are going to be involved in your birth, and they need to know what you're looking for. So, yeah, like you said, there could be pictures, it could be a birth plan, it could just be telling people. I have a lot of like patients and friends that do hypnosis. They do birth hypnosis.
Yeah.
There's a woman, she's Australian, and she has like maybe 9 or 10 episodes. I've listened to a few of them just to kind of see what it was about. And I that's more of like an auditory way to manifest and relax your body and try to envision that birth experience. So, yeah, I think I listened to one or two of the hypnosis when I was pregnant with one of my children, and I just kept falling asleep, which is probably what they wanted. But I was like, I don't
Sounds
know.
like it worked.
Yeah. So, and then I ended up just not being super consistent with it, but a lot of people find it helpful. So
Oh,
I
yeah.
think there's benefit to like teasing out specifically what you're looking for and finding a way to communicate that.
Yeah. Yeah. And I think doing that prenatally with your partner is really important because in class, I'd say the word calm down or something like that is not very helpful.
Yeah.
So establishing what are the helpful phrases? What are
Mhm.
the things that actually, where does the mom like to be touched? How can you help her by massaging her back, her upper back, her lower back? Does she want to use water?
Yeah.
Getting all those things in place between you and your partner or whoever's going to be at your birth is really, really important thing too. So, and the attitude, like you just mentioned, having it in your own brain, what you want to do and how that's going to materialize. And
Yeah.
it doesn't usually generally just materialize. It's you creating the vision that you can fulfill, which is
Yeah.
very cool, right? One of the things I thought about is, asking for the right caregiver. And sometimes in the old days, because I had my babies when Moses was still alive, um, you can find that one caregiver who totally supports your vision. But I think that's harder now, isn't it? Like there's groups of doctors, right? How does
Yeah.
it look for you?
I think it's tricky because I think like people are people where no matter what profession they choose. So just like you're going to find teachers that are like life-changing teachers that have like a lifelong impact on you or your children. And then you're going to find teachers that you're like, why are you doing this job? Like go work somewhere else. And I think that applies for pretty much every profession out there. And it's definitely going to apply when it comes to providers, nurses. Nurses are not immune to that. There's going to be doulas. There's going to be everything when it comes to medicine and birth. There's going to be incredible, life-changing, supportive providers or nurses or doulas, and then there's going to be a few in there where you're just like, why? So yeah, I do think I'm hoping like that in America, especially, that our culture is starting to maybe a little bit shift towards more of a collaborative birthing experience with the patient. I'd like to think that we're starting to let go of some of the old habits we had that were a little more conducive to like the staff and the providers practice and not so much for the mother. But yeah, I mean, it's old habits die hard, and there is a hierarchy when it comes to medicine if you're going to be birthing in a hospital. And again, if you've just got some people who don't get it, it can be tricky. It can be really tricky. And I think if you are like matched up with a great team, it really can change the entire experience for you. So
Mhm.
so yeah, I'd like to think we're starting to move a little more in that direction, but it's slow. I'm going to be honest. It's slow and it's hard,
Yeah.
and it's going to take, I think, generations of work, honestly.
Yeah. I had a podcast with the folks from Team Birth, which was
Yeah.
one of the first real shared decision making uh, place where they took all the notes and came up, the research was published. And I hear that other hospitals are starting to do that too. But whether they follow the team birth process not, um, the shared decision making, I feel like it is coming. We got some great OBs at the hospital that I work with and some great midwives there too. So, and the nurses are fantastic. I've worked at a lot of facilities because I've moved around in my life, and it's so important to have that great nurse. And I think you were probably lucky did you get to handpick your
Oh,
nurses?
of course. Yes. I've said, it's there's some aspects to being like a labor and delivery nurse that I'm the same patient as everybody else. Like it's not like I'm getting in earlier to appointments than anybody. None of that. I don't get a discount when I give birth, but there are some things I know I pay as much as anybody else, but there are a lot of like privileges to giving birth, like where I work, and being an expert in my field, because I mean, which is why I made my platform, is I'm like, why should I have this knowledge and nobody else? I'm able to
Right.
make these decisions because I have a lot of knowledge. So yeah, it's a privilege that I have the knowledge that I do, the experiences that I do. And part of the privilege too, just like a very pragmatic one, is I can literally just have my husband call the unit when I'm in labor and be like, can you set aside the room with the tub because my wife is in labor? And they'll be like, hey, sure, what nurse? We're bringing our nurse. And I get to handpick. I get to handpick if some, like for a couple of my births, the nurse that I wanted to deliver my child wasn't even scheduled to work. So she just showed up with me. She drove in with me and then clocked in and delivered my baby. And I mean, that's privilege. It's something I wish everybody was able to do. I know that's not terribly practical when you look at it, but I think there's a version of that, which is, if you can, if there's a way you can bring along somebody like a doula or a family member who's going to be a really, really good advocate for you, who's informed, who knows what your preferences are. And then again, because we've talked about how culturally we're trying to move towards a better direction, but there is always going to be some people resisting that. So this one's really, it's going to be a gamble, but I think something that people can do who are not privileged labor nurses like me can call, or have a support person call as you're headed to the hospital and say, this is what we're looking for. Do you have a nurse who's going to be supportive of unmedicated birth or minimal intervention? Like if one of those nurses is available, that would be the perfect match for us. And you absolutely have that right. If I were not a nurse, that is exactly what I'd be doing, and having my husband call on my way to the hospital and do my best to handpick the right kind of a nurse for me. I think another thing that's important to put out there, that I try to put out there on my platforms, is you also have the right to notify like a charge nurse or somebody if you are not matching up well. If you're not you, but if you're the staff that was chosen for you
Mhm.
is not the right match. It doesn't even need to be anything majorly offensive. It doesn't need to be terribly personal, but sometimes like some personalities are just not the right match for other personalities. So if you're like, I need someone who's got a more loving touch, I do not need tough love. I do not need someone who's going to be negative. Say nobody goes unmedicated with their first. If you're getting that kind of an energy from somebody, you have every right to be like, hey, I'd like another nurse. And it can be a hard conversation, but that is your right. And I'd say the benefits to that, even if it's a tough conversation to have, may be uncomfortable for you. The benefits of that are huge because if you're matched up with the right person, like we've talked about earlier, that can change the entire trajectory of your experience.
I totally agree that, and even as a doula, I have experience where the parents, they were a little afraid to ask. And
Mhm.
it's not, as a doula, doulas don't speak for the parents. So I couldn't ask, but I did encourage them to ask. And they did ask the charge nurse, and the charge nurse said, of course, this is
Yeah.
your birth. Of
Mhm.
course, we're going to get you somebody who feels like a good match. And it wasn't that she wasn't saying anything negative against the other person. It was a personality issue. And it really changed up the rest of her birth. So
Yeah.
I agree with you on that. It's hard. It's a little
Yeah.
intimidating, but when you say that it's your body, it's your baby, you're the one that's taking this person home. So yeah,
Yeah. And then
I
you'll be the one that has to process this down the line, and it's you don't think about it in birth. I think a lot of people they kind of like diminish the value of a birth experience. They kind, especially when you're making birth plans and going to all this level of prep. And I had a midwife once say to one of my patients, like, well, birth is just a drop in the water. Like there's so much, parenting, all that stuff. I know what she's getting at. I know she was trying to be like, oh, if it doesn't go the way you want, like it's not the end of the world. I get that. But I feel like we also need to maintain a perspective of like, it is a drop in the water. Yes, the time of it could be a day or two, but it's one of the most important drops when we're talking about its effect on your risk of postpartum depression or anxiety or postpartum psychosis or how your parenting experience is. And it's like when you walk out of that, how are you going to recover mentally, physically, emotionally, how your experiences with your newborn and bonding and attachment. So if we that's not one that we can diminish. Like we really need to do our best to get it right, and we need to stop like poo-pooing, dismissing people who are prepping for that, because I don't want people to feel like a failure if things look differently than they had expected. But I also don't think we need to diminish that we should prep for it and really take it seriously, especially as staff or birth workers. Like they are the ones that are going to be recovering from this and processing it for months or years. We've really got to
yeah,
minimize the trauma here. So finding the
you
right
know,
match is important.
yeah. In the journal Birth, it comes out of England, but it's readily available here. Um, Penny Simkin, who's my hero, she wrote an article, I think back in the 80s or early 90s, entitled, it was a three series, and the one I'm talking about is entitled Just Another Day in a Woman's Life. And without all we know now, without all of the things that have happened since then, she pegged it. She pegged it. She said, this thing is going to stay with her for the rest of her life. So we need to have her surrounded by people who love her and care for her and support the journey that she's on and the direction that she's going. Because women don't need to be told what to do. They just need to be supported in finding their way. So,
Exactly. Yeah.
and sometimes I think people step into the hospital and they feel like they've lost control. Like
Mhm.
this is not their domain anymore. They were at home doing their thing and now they're in the hospital and someone else is in charge. But I think your words are encouraging in the fact that, yeah, if everything's equal, everybody in the room is going to be pulling in the same direction. But if it's
Mhm.
not, let's make a change. So
Yeah.
that's very cool. Um, you had talked earlier to me about spinning babies. Do you use spinning babies to
I love
help
it.
women achieve their goals in the hospital? Can you talk a little bit about that?
Yeah, I love spinning babies. It's one of my favorite things as a labor nurse and as a pregnant person. So if people are listening and don't know what that is, it's like an entire program. There's a website, there's classes, and what it does is it helps sort of educate about the importance of the baby's physical position in relation to the pelvis. And it helps you troubleshoot, because if maybe the baby's in a position that's not super conducive to dilating or descending and putting pressure on the cervix, it really helps you map out ways to promote better fetal positioning. And it is not invasive. These are like things that people can do at home. These are things birth workers can do. And it's like, I can't possibly convey what I've seen anecdotally in my practice when I implement just understanding like the physiological process of baby's position, pelvis, all of that, especially when it comes to like pushing, things like that. So I think maybe when I was like a labor nurse for 2 or 3 years, somebody started teaching me spinning baby moves. And then they started showing me the website and I started learning. And I just saw it like saving women from C-sections left and right because of like, we weren't progressing. And then it just helped me really understand like the physics of baby clicking into the right position and that pelvis. And then when I was pregnant, I was starting to do stretches and spinning baby moves every evening towards the end of my pregnancy. Again, not because it's going to guarantee me that things will go perfectly, but it just increased the odds that my ligaments would be stretched and relaxed, that my baby would be in sort of a better position for labor. Because 2 of my 3 babies, my placenta was in the front, and babies have a tendency to sort of look in the direction the placenta is. So if your placenta is in the front and the baby's going to usually be facing in the front, and a baby that's looking at your belly button can be a little bit hard to engage into the pelvis. It's a little easier for a baby to be turned the other way and looking at your spine. So when I did spinning babies, it was really, really helpful because my babies were always looking at my belly button to spin the babies around. With my 3rd baby, I remember I was at the hospital and I was definitely in labor, but she kind of just was hanging out at 4 or 5 centimeters. And I was having these contractions were not fun. They were hurting. And my nurse/friend, she like forced me to do a spinning babies move. And it was the worst thing that ever happened to me. But boy, did I dilate and have a baby 2 hours later.
She knew.
She knew. Yeah. And I even was like, please don't make me. She's like, you don't have to do anything. She's like, but if you want to have a baby, you need to spin
Well, I
the
know
baby.
this isn't a spinning babies ad, but truthfully, educators can become spinning baby parent educators,
Yeah.
and birthing people can go and look on the spinning babies website to find ideas or to find spinning babies educators in their
Yeah.
area. So it's important enough that we'll give that a plug.
Yeah, and it's got, there are so many free resources on their website. I mean, you could go your whole pregnancy without even having to pay for anything because they put so much out there for free. It's unbelievable. I want them to get payment. I want them to be able to keep growing, but it's incredible. And I don't know if you probably know this as you are on top of all the studies, but they recently Spinning Babies did their first very small study in a hospital setting where they trained the staff and then they measured the outcomes and it drastically reduced the rate of
Yeah,
cesarean.
I saw that. It's
Yeah.
amazing.
Still
Amazing. So,
small, but I think it's the first like tangible, real like evidence we have, and we can start moving and exploring that more.
right. Um, when people watch, even if they watch Call the Midwife, the moms are basically in a stationary position in birth. And I think part of when you go to the hospital and you feel like you're not in your domain and you've lost control again, parents tend to be stationary. And I tell them that's the wrong thing to do if you would like to have a natural childbirth, because stationary, I talk about it like sitting in a car for 18 hours. If you're
Mhm.
sitting in a car for 18 hours, your body's just going to hurt and
Mhm.
you've lost your power. So, what positions, what kind of ideas did you use for movement in your births?
I think I did a lot of like upright, forward leaning positions. I was pretty mobile. I did a lot of tub, a lot of the tub because it helped me relax and
My
it was good for
favorite.
relief. I love it. Well, I have one friend who hated the tub. She's like, I was sweating the whole time. Like it was not my vibe. But yeah, I think that was actually another one of the reasons that I chose to like forego the epidural was and again, another thing, like the risk of sounding cheesy, but I kind of wanted to leave like a stream of open communication with my body. I wanted to, it's great that the epidural can kind of shut off that sensation. Like, hey, we know we're in labor. You don't need to remind me. But for me, especially with my babies wanting to always look at my belly button, I wanted an open stream of communication because something that I found as a labor nurse was a lot of times the things that relieve the pain and discomfort are things that are going to move us forward in labor. So like if my back is hurting really, 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 really bad because my baby's looking at my belly button and not, we call that asynclitic, they're not clicked into the pelvis really well. Moves that relieved that pain were like leaning forward, lunges, squatting, counter pressure, it was sitting on a birthing ball and resting forward and rolling. That relieved the pressure that the baby was applying to my spine, the discomfort, but also leaning forward and opening my pelvis was encouraging my baby to kind of corkscrew herself in a better, more like facilitating that whole process better. So that's kind of why I wanted to feel where my pain was, because it was like made me more cognizant of how to like work with my labor. So yeah, I did a lot. I think two of my three babies, there was a lot of, yeah, that baby was facing not a great way, a lot of back pain. So I did a lot of forward leaning lunges, a lot of swaying. I swayed a lot. And then when I was in the tub, I almost never was just kind of laying backwards on my back. In the tub, I was, maybe leaning forward on a ball or leaning over the side of the tub and maybe had a leg up or something. There was almost always something that was encouraging sort of either my feet or my knees out and kind of relieving the pressure off of my back.
Which makes total sense because if your pelvis is stationary, it's a very small location. So the
Yeah.
baby is doing this whole bobbing their head, trying to figure out how to get down there. And if you continuously moving, even in the water, you're
Mhm.
giving the baby a chance to find the right path down. So I
Yes,
like that.
exactly. And I think it's good too, especially in active labor. And if you are considering an epidural, I say to my families all the time, like, if you're going to wait to get an epidural, or if you're not going to get one at all, don't do it for nothing. Like, utilize your mobility, utilize that movement. Yes, there's periods if you can rest, that's awesome because it's tiring. But when if you're like cannot rest, I want you moving and taking advantage of the legs that you got, because it really is going to help. Kind of, even the evidence shows us that's the one thing you can really, really do to sort of move your labor along and give yourself a better chance of like a vaginal delivery, if that's what you're looking for.
And then we talked earlier about when I say earlier, Sarah and I talked yesterday, so we're referring back to that. So we talked about eating in labor because if you're going to be moving a lot and expending a lot of energy, and then you're going to be expected to push this 7 pound baby out of your body, energy is really important. And I know not every hospital allows you to eat, which maybe will be changing. My fingers are crossed for that. But would you eat through the whole thing, or are you letting your hunger be your guide, or how does that work?
So for me personally, as a mom, I did eat during like early labor. If I was hungry, I ate, and then because I used the tub a lot, my husband was always trying to encourage me to drink just so I wouldn't get dehydrated from the heat. So I just followed my own hunger cues. And then as things were getting sort of closer to that final phase of labor, as I was getting like, gearing up towards, 8 or 9, I don't know, I'm guessing 8 or 9 centimeters. I didn't have a lot of exams. And then I was pushing, I didn't have any hunger. The last thing on my mind was food or anything way future down the line. I was just in the moment. So yeah, for me personally, I definitely followed my hunger cues. I definitely had like orange juice or cereal, or I know my husband brought donuts home at some point. So I had donuts or something. And then for my patients that I care for, this is something we had talked about yesterday was, the evidence is pretty clear that the we should be sort of moving more in a direction of following hunger cues for low risk people, of maybe not starving them for this entire labor experience, unless there's a very high risk of them having general anesthesia. And but again, like we said earlier, this is slow moving. It's hard to break old habits. And the people that are doing the C-sections or managing your airway on the anesthesia team, they're going to want to be extremely cautious, because they're the ones that are going to have to help you if things go awry. So I know that that's taking a very, very cautious approach. We're trying to sort of find a better middle ground of allowing people to eat and acknowledge their hunger cues and take solids, and only minimizing that if you have like a really high risk for general anesthesia. But again, like, it's slow moving. So I think if that's something that you're going to be wanting to do during your own birth, I just, like I've said on all of my videos, you really want to know the risks, the benefits, the alternatives, something to talk about with your provider, and, find a happy place. The end of the day, you're the boss. So if my patient wants to eat, even if the doctor's like, we only recommend clear liquids, at the end of the day, I mean, this is not prison. So if she wants to eat, I'm not going to slap a chicken wing out of your hand. So yeah.
I was an EMT when I lived in Iowa, and I know that I never left a patient on the side of the road because they were in a car accident and it was obvious they were going to need surgery. But I saw a Burger King bag and I knew
Mhm.
they had just eaten. I didn't leave them on the side of the road. I
Yeah.
have every um, hope and really evidence in the anesthesia process that they know what they're doing. Yes, we could make, if he didn't have the Burger King and he does need his legs set, it would maybe have been a little bit less risky, but I knew that he was going to be taken care of. So
Yeah.
if I can bring a person in from a car accident, um, in a wild situation, let's do the same for. Okay, that's my 10 cents on that one.
Oh yeah. Well, I mean, with us doing high risk, there are women who just, or individuals who just come in and they're in their street clothes from an appointment, and we need to do a C-section. I mean, immediately. That's not very common, but it happens. And of course she just ate, and yet we're still doing that, because the risk of not doing it and waiting for a safe time for, since she last ate, would be much higher than just proceeding. And I think it's like a lot of things we talk about when it comes to birth, as far as when do we induce? What are our thoughts on elective induction? What are our thoughts on due dates and post dates? All of that, like, yes, if we want to be extremely cautious, anybody can, we can make a case for all of it. We can make a case for starving everybody in labor because of this small risk of like aspiration. We can make a case for not. And I think that's why we just look at where the evidence is guiding us. And it's these days it's guiding us more towards allowing women to give themselves calories. As long as we understand that if we were to go under general anesthesia, there is still a risk of that. And we have to, the anesthesiologist is equipped to manage it. I'm sure they would not want to manage that, but
Right.
yeah, it just, everything we're doing, there's going to be risks and benefits. So
Right, right. We can't leave the house, or we couldn't stay in the house, or wait. Um,
exactly.
okay. And I was thinking that you talked about flexibility to begin with. We really do want people to prepare for the natural childbirth that they want, but we can't let them be so rigid. And you talked yesterday about giving yourself grace, and I said flexibility is really queen.
Mhm.
What are your thoughts around that?
Oh, absolutely. I think pretty much everything in life will require a little bit of flexibility, because I mean, even as a parent, there are just things that you cannot control. And so, we can prep to the best of our abilities, and I think it's important to prepare and do what you can to get yourself ready for whatever this milestone is that's coming. But there does require a little bit of flexibility and being kind of open to changes and flexing with the changes. And yeah, I said for me, it was giving myself grace as far as, an unmedicated birthing experience, or not getting the epidural, because I knew my reasons why I wanted to go that route. But I also acknowledged that sometimes things just take a different path. Even it doesn't matter if I walked and did my yoga and did my birth classes and I ate my dates every day and like it may take a different path. And I need to give myself grace if I make different choices than what I had been planning up until that point. And I think that's a lesson that can be really carried into every aspect of life, especially as a parent, as a mom, like every day there has to be some flexibility, with, you have 5 kids. So yeah.
Yeah. Well, and with my having 5 kids and having one epidural, when I present that in my class, I always say, "Oh, your first one was an epidural." I said, "No, no, actually, my last one was an epidural." And it was because he had his hand up like this. So trying to get the circumference of that out of my body was challenging. And I actually did not get my epidural until I had been pushing for a good time. So, and my pelvis was what hurt, not the contractions. And I said, if I could just deaden the pelvis, I think I could move around more, flip this way, flip that way, get on my hands and knees. You can do that with an epidural with help.
Yes.
And yeah, he came out. He was a vaginal birth after many, many hours. So, yeah, I
Amazing.
think being flexible, I mentioned this, that it's like you're starting here and you're ending here, and you want it to be a straight line. I'm going on this straight line, but hey, there's a big car accident. So I'm going to have to get off. I'm going to have to go up this way. I'm going to have to go over this way. Eventually, I'm going to still get there. But if we if I have a rigid road plan, maybe I'll have to sit on the highway for 14 hours till they clear it. That's silly.
Hmm.
You can make changes.
I agree. And I love that story of your 4 unmedicated and then getting an epidural with your fifth, because I feel like I love hearing stories like that because you have done it. You've shown that you've done it. You show that it was what worked really well for you. And I think it's so important to see like an actual example of how we can apply that flexibility. And it's hard too, because especially when we talk about like birth and the culture of birth in America, and there's a lot of like distrust with just our healthcare system. Sometimes people want to be a little inflexible with their birth preferences because there's distrust. You're like, is this the provider doing these things I've heard where they're going to coax me and coerce me into something that's unnecessary? So I really need to stand up for myself and be bold and have firm boundaries. There is an extent of like you can have firm boundaries with your plan or your preferences, but there also, again, there is going to be a little bit of flexibility where sometimes we do need to be open to changes and just course
Right.
correct or redirect. Yeah, it's a hard balance. Yeah, I think if we had more trust in the healthcare system, I think if we didn't have such like a murky past with women's health, maybe we wouldn't have to address the concept of flexibility to this extent. I get why people feel inflexible, but I love your story. I love that you're like, this is how I had to be flexible. So
Yep. Well, I thought for sure I was going to have a cesarean. And when my doctor talked me out of having a cesarean, I said, well, I at least need to have an epidural. And he said, what a good idea. And I've taken that to work in my business and my teaching too, that, not every doctor is inflexible. He actually taught me that
yeah.
to ask the question. Okay, he said it to me this way. You could have a cesarean, but you have 4 other babies at home and you're doing well and your baby's doing well. So if you'd like to continue, we can do that. Then when I said I at least need an epidural, he said, what a good idea. And if we need to move to a cesarean, it'll be in place. So
It's reasonable.
yeah,
Yeah,
still a buddy of mine
I
because
love that.
he was looking out for me, not him.
Yeah, you're in charge. You're the one. That's true collaborative care. It's like he's weighing in on the risks and benefits with you, that your choices, and then really let you decide how you want this to move forward. So I love
Yeah.
that.
And we didn't even talk about all of the things you can do at home including eating and taking a bath and taking a walk,
Yeah.
going out and playing with the dogs in the yard and all of those things. I only mention to my clients that whatever time of day it is, do the appropriate thing. If it's 2 a.m, don't go for a walk with the dogs. Stay in bed, stay
Mhm.
in a resting position, keep the lights off. But if it's during the daytime, get on with your life and do those things before you end up going to the hospital. Sounds like that's what you did.
Yeah, that's what I did for all of my children. Because that was one of the reasons I wanted to kind of skip an epidural or skip an induction is I didn't want to be in labor in the hospital room for very long. I'm a mover. So yeah, at home, when I went into labor, I just stayed home as long as I was comfortable staying home. And with my first and my second, I told you this yesterday, this is where the nurse privilege comes in. I have like really great friends who are my coworkers, and they were able to just come to my house and do a cervical exam because it'd be like per my request. It wasn't necessary, but I just was like, I live a ways from the hospital. So I didn't want to push it too far and like deliver in my car. That was not on my preference list. So I would have them come and do an exam. And I think when I was about like 4 or 5 centimeters with my first, they said like, this is how dilated you are. And I was like, I want to go in. 'Cause I'm ready to go in. I want a little more support. And then with my second, I felt physically really well. I felt like I could have stayed home for hours, but I was like maybe 5 centimeters and I was progressing pretty quickly. And with my second, I was GBS positive and I wanted IV antibiotics to
Right.
prophylactic. And
Mhm.
so my friend, my coworker was like, I mean, if you want the antibiotics and you want them on board for 4 hours, you're going to probably want to head in. So I did that. And then with my third, I was a regular person and did not have anybody check my cervix. And I just knew I was rocking and rolling in labor. And I was like, we're going in. But I definitely stayed home for hours for all of them.
Mhm.
My first, I think I was home a good 8 or 9 hours. And I don't even remember off the top of my head with the others, but again, it was just about my comfort. It was about I wanted kind of a hands-off, minimal intervention approach, and I liked the comfort of my own home. I liked my
Yeah.
food, so
It's a good way to go. Well, I
yeah.
think we've talked about so many things. One of the things I've had the privilege of doing is attending home births with a midwife. And of course, all of those were natural childbirths because that was the plan. In 4 years, we did 50 births. We transferred twice. So the rest of them happened at home with all the things that we are talking about. They walked, they ate, they slept if it was night, slept between contractions. I think women need to give themselves a lot more credit than we
Mhm,
do. If that's their road, if that's the path they want to go on, they should go for it. And if that's not their path, nobody should make them go on it. So,
mhm. I agree.
yeah. I appreciate talking with you so much. You have such great stories, and everybody will be looking up Labor Junkie RN on Reels and finding out more about you there. And I appreciate you.
Thank you so much for having me. This was so wonderful.
This episode of InCast is complete. Tune in regularly to hear more insightful conversations. And be sure to visit enjoyhealtheducation.com to see how Enjoy can help you inspire families and staff through our diverse childbirth and parenting teaching solutions. Or call us at 1-800-326-2082. The views and opinions expressed in this podcast are those of the guests and do not necessarily reflect the official position of Enjoy or its employees. This podcast is intended for informational and educational purposes only and does not serve as medical advice, a basis for diagnosis, or recommendation of treatment.